Good afternoon, everyone, and welcome to today's webinar discussing physical activity measurement and its implications in the Black community. I'd like to thank you all on behalf of the African American Collaborative Obesity Research Network and the Center for Diabetes Translation Research at Washington University, St. Louis, for your participation this afternoon and interest in this topic. During the presentations today, we ask that you post questions using the Q&A button in the Zoom webinar interface. We will review and select questions for our panelists to respond to after their presentations. If your question was not selected for response, we will share follow-up feedback after today's session. Please feel free to use the chat window to interact with fellow attendees during the session this afternoon. This presentation will be recorded and archived for future viewing. We will publish the webinar online and share the link via email. My name is Sheldon Oliver Watts, and I am the National Director of the African American Collaborative Obesity Research Network, also known as AACORN. AACORN is a collaborative network of scholars and community-based research partners located in over 20 different states. Our national office is located at Drexel University's Dornsife School of Public Health in Philadelphia, Pennsylvania. AACORN leverages the credibility and perspectives of Black American researchers and research partners to facilitate more relevant, community-engaged, high-impact intervention research. I'm also the core manager of the Solutions to Diabetes in Black Americans core at Washington University Center for Diabetes and Translation Research. As a disparities core, we provide methodological and content expertise to develop innovative approaches that advance the field of diabetes research in Black Americans. Today's presentation will address the well-established benefits of physical activity for preventing and treating chronic diseases, including diabetes. Although self-report measurements suggest that African Americans engage in less leisure time physical activity than other population subgroups, objectively measured physical activity suggests that African Americans may be more active overall. Our panelists will discuss differences in physical activity patterns obtained from self-report and objective measures of physical activity and the impact of these assessments on public health recommendations and campaigns. They will also describe specific benefits of leisure time physical activity and efforts to address disparities in leisure time physical activity in African American populations. Our respected panelists today include Melicia Whitt-Glover, President and CEO at Gramercy Research Group in Winston-Salem, North Carolina. Dr. Whitt-Glover is responsible for developing a program of externally funded research to advance Gramercy's mission of developing sustainable strategies that promote and improve the health and well-being of the public. She is also Executive Director of the Center of Excellence for the Elimination of Health Disparities at Winston-Salem State University. Her research interests include the role of physical activity in obesity prevention and control among racial and ethnic minority groups, physical activity behavior change programs among racial and ethnic minority groups, physical activity assessment, community-based participatory research, faith-based health promotion, and minority health and health disparities. Olivia Affuso is an associate professor in the Department of Epidemiology at the University of Alabama at Birmingham and an associate scientist in the university's Nutrition Obesity Research Center and Center for Exercise Medicine. Dr. Affuso's research focuses on the prevention of obesity and chronic disease through physical activity, body composition methods development, and the design of obesity-related randomized controlled trials. I would now like to invite Dr. Glover to open our presentation today with a talk on differences in physical activity and implications for measurement.
Thanks, Sheldon, and good evening or good afternoon, and thanks to those who have joined us on the call today. I'm going to talk a little bit about physical activity patterns and some differences we might be seeing in those physical activity patterns and what we can do with that information. Let's see if I'm, okay, there we go. Hold on one second because my slides do not seem to be advancing. Here we go. Okay, so what we know is that there is some element of the truth that's out there with regard to physical activity. Depending on how you measure, you get different answers, and so I'm just going to talk a little bit about those different measurement tools, what they say, and what we can do with that information. Sheldon has mentioned that we are a part of the Center for Diabetes Translation at WashU, and so I did just want to put this information up just to kind of remind us of where we are in terms of obesity and diabetes among adults in the United States. And so you can see these slides show going from 1994, showing you snapshots from 1994, 2000, and 2015. You can see that the obesity epidemic as well as the prevalence of diabetes is increasing rapidly. And you can also see where there are segments of the United States where rates for obesity as well as rates for diabetes are higher than in other segments of the community. One of the things that we know about both of those health outcomes, obesity and diabetes, is that physical activity is one of the health behaviors that has been shown to be linked with them, and that increases or improvements in physical activity can positively impact both obesity and diabetes. I'm going to share with you some national sources of physical activity data, and I picked a few that would kind of give us a sense of what physical activity patterns look like. And you can see here the ones I'm going to talk about. There are not a lot of national sources of physical activity data. There are lots of local sources, but very few national sources. And so you can see BRFSS, the National Health Interview Survey, NHANES, and then I also chose to select some information from the American Time Use Survey. And the right column shows you which types of physical activity are assessed in those tools. And I think that's important as we move forward, because as you look, for example, at Behavioral Risk Factor Surveillance System, they assess leisure time physical activity, but also household and transportation-related physical activity. NHIS and NHANES are limited to leisure time physical activity, and then the American Time Use Survey assesses activity in occupation, household, and leisure. So starting with the BRFSS data, this is not broken down by race ethnicity, but I wanted to kind of give you just a snapshot of what physical activity patterns look like. And these are data from the Centers for Disease Control and Prevention. And what you can see, the right hand side of the slide here kind of gives you a legend in the sense of what these colors mean. And so the darker the color, the more people are engaged in whatever that is. This slide is a representation of the percentage of adults who are obtaining at least 150 minutes a week of moderate activity or 75 minutes a week of vigorous activity, essentially those folks who are meeting physical activity recommendations. And if you think back to the obesity and diabetes slides, what you can see here is in the states where less than 8%, less than 18%, so less than 1 in 5 or so people meeting the recommendations, concentrated right in this area, those are also the states that had some of the highest rates of diabetes and obesity, if you remember that. These states with the darker blue have higher proportions of people in the community who are reporting that they are meeting physical activity recommendations. And again, remember, this is BRFSS assesses leisure, household, and transportation. The flip side of that is looking at adults who report that they engage in absolutely no leisure time physical activity. So this is just leisure time. And again, you can see, so the reverse of what we saw in the previous slide, the darker concentration here is the highest rates, and you can see this segment of the states in the sort of southeast, south region that had the highest rates of obesity, the highest rates of diabetes, the lowest rates of participation in meeting physical activity recommendations, also had reported the highest rates of not doing any leisure time physical activity. So that was the behavior risk factor surveillance system. Moving to the National Health Interview Survey, again, looking at leisure time physical activity, the data here suggests that there are some disparities, particularly by race, ethnicity. You can see there's differences with higher rates of self-reported adults who self-report that they were highly active, and these, according to the 2008 physical activity guidelines, and these are data from NHIS 2009, but you can see here there are some disparities with Blacks and Hispanics reporting lower rates of being highly active compared to whites, and you can also see there's some disparities and differences by gender or sex in education as well. So that's NHIS data. Susan Carlson and colleagues actually took a look at meeting different guidelines using the National Health Interview Survey data, and this paper was published in American Journal of Preventive Medicine in 2010. And just to kind of highlight here, looking at the differences by race, ethnicity, so whether it's the Healthy People 2010 criteria or the 2008 physical activity guidelines, what you can see is there are lower rates in terms of, again, leisure time physical activity, lower rates reported of people who are meeting guidelines by race, ethnicity, with higher prevalence among whites, and then other non-Hispanic groups compared to Blacks and Hispanics. So again, self-reported leisure time physical activity, lower rates in Blacks and Hispanics compared to whites. These are data from the National Health and Nutrition Examination Survey. This is a study published by Tucker and colleagues that looked at self-report, and so I want just to orient you to the slide. This is self-reported physical activity using NHANES data, and I make that distinction because in a minute I'm going to show you objectively measured data. But looking at the self-report data from NHANES 2005 and 2006, what you can see here is the proportion of U.S. adults who were meeting those guidelines. You see these disparities with the highest rate, so 63% of non-Hispanic whites report meeting those guidelines compared to 47.7% of non-Hispanic Blacks and 41% of Mexican Americans. These three columns represent just three different ways that Tucker and colleagues broke down the physical activity data. So across those three self-report tools, you saw that there were disparities in terms of meeting physical activity recommendations by race, ethnicity. I also just wanted to highlight a paper that I did with a few colleagues. I think Wendell Taylor might be on the call, but we looked at data, self-report data, even within the Black population to try to understand what some of the nuances were and differences within the Black community. And I'm not going to talk a lot about that, but what I did just want to point out is when you just pull data from these national data sets just among Blacks, the differences are different. I mean, the prevalence of people who are meeting recommendations vary greatly depending on the source that you use. So if you look at NHANES data among men, about 30% of men are meeting recommendations. If you use NHIS data, about 28% of people are meeting recommendations. But if you look at BRFSS data, you've got about 42% of people meeting recommendations, and this is for men. And you can see similar differences when you look at women across these three data sets. So I think one important thing to think about as we're thinking about physical activity patterns is there are differences depending on the source of data that you look at. You're going to get different answers in terms of the prevalence, how big the problem is versus how small it is. Now let's look at objectively assessed data, because we know that, you know, when people self-report, they can remember things differently. They can remember, they may recall that they're doing more physical activity than they're actually doing. And so it's always good to look at objectively monitored data as well. So in 2000, I believe the 2003 and 4 and the 2005 and 6 iterations of NHANES, they also collected accelerometer data on a subset of the population. And so this is looking at mean accelerometer counts per minute by gender, age, and race ethnicity. And the thing to point out here is where we had previously seen those large disparities in physical activity, when you look at it, objectively monitored data, what you see starting at ages 6 and 7, and this is separated by males and females, you can see that those differences kind of change. And so in ages 6 to 11, non-Hispanic Black males and females are actually getting more physical activity than other population subgroups, which is opposite from what we see in our self-report data. You see the same thing in ages 12 to 15, at least for males. You start to see those differences diminish, and you start to see those differences diminish in females as they get older. These subscripts also indicate when the subscripts are similar, or the superscripts are similar, that indicates that those are the rates by race ethnicity group are the same. So where you see the same letter, that means those groups are the same. There's no differences. And so you can see here those disparities that we were seeing before are not present here at 12 to 15. When you start to get a little bit older in ages 16 to 19, you see non-Hispanic Black males are actually significantly participating in significantly more physical activity than the non-Hispanic whites, contrary to what we saw before. When you get to ages 20 to 59, again, you see the same thing. So Mexican Americans are actually participating in the most amount of physical activity, but the disparities aren't here in terms of males or females. The disparities in terms of physical activity are disappearing. And again, these are objectively monitored physical activity levels. So I showed you, so this is looking at mean minutes per day in physical activity for moderate and vigorous physical activity overall, again, using that NHANES data. And again, you see the same kinds of things. So this is just looking at minutes per day as opposed to activity counts. And for the sake of time, I'm not going to go through all of these, but I think the most important, the punchline here is you don't see these differences by race ethnicity when you look at the objectively monitored data, You see very similar patterns, but you see higher rates, particularly in adults, among Mexican Americans compared to other population subgroups, especially when it comes to men. Again, going back to the Tucker study, so remember I first showed you that there were these disparities in the Tucker paper looking at NHANES by race ethnicity. This was self-report data. I'm going to now show you they used the same analysis, and they looked at differences using different ways of looking at the data, using accelerometer-based data, and you see the same kind of pattern. So with the self-report data, you saw differences in disparities in the non-Hispanic white population had higher rates. When you look at the I don't know why I can't say that word today, accelerometer assessed physical activity, you see that those patterns actually shift. They don't look the same as when you're looking at self-report data. When you're looking at all types of physical activity, those differences disappear. So one of the questions is, well, if it's not leisure time physical activity, what kinds of activity are people doing? And there are data from the National Household Travel Survey that look at other types of physical activity, so transportation. And this is, these are data, a little bit older data, but the patterns are still the same for the National Household Travel Survey that show, for example, if you're not looking at leisure time or you're looking at other domains of physical activity, there are differences in terms of modes of transportation. Blacks report a higher percentage of trips taken by walking, using walking as a means of transportation compared to whites. So Blacks, Asians, and Hispanics report higher rates. When you look at bus and light rail as a transportation means, you still see these higher rates in Blacks. And why I think that's important is because there's also some walking involved with getting to and from those sources of transportation. And so I think that's important. Interestingly, we looked at some of the data from the American Time Use Survey, and there were some interesting nuances and differences when you looked at how people engaged in physical activity. So a 2011 paper, working paper, looked at racial and ethnic and gender differences in physical activity and showed that when it came to leisure time physical activity, Blacks and Hispanics participated in less activity than whites. When it came to active travel, according to this, Blacks and Hispanics participated in less activity than whites, but then after controlling for covariates, you didn't see those differences anymore. Home physical activity, other physical activity, and non-work physical activity all showed the same picture in terms of disparities. But then when you looked at occupational physical activity, Blacks and Hispanics actually achieved more of their physical activity through work compared to whites. So now you've got these differences with how people are getting their physical activity. These are data also from the American Time Use Survey, and I just pulled, these are data from 2016, and it's looking at breaking down the most recent data. This is hours per day in terms of how much time people spend in different modes of physical activity. And interestingly, when you look at this, you can see, based on the data that were identified, Blacks actually spend more time in leisure and sports, according to the National Time Use Survey. And then in other activities, and more time in organizational, civic, and religious activities. According to this, they're spending less time in working activities. Some of that could be because this is taking into account everyone and not the working population. The data were not readily available to look at just these activities in the working population. But this tells a little bit different story. So then when you look at the leisure and sports, the question is, well, what is going on here? Because we've seen that leisure time physical activity at least is lower in Blacks compared to whites. But then when you look at the time use survey, it looks like leisure is higher, which is telling you a different story. When you break down how people are engaging, what people are doing during leisure and sports time, what you can see is that when it comes to sports as it relates to this, there's a little bit of a difference in physical activity here. Blacks are spending less time than whites and Asians. Blacks are spending more time watching TV during leisure, more time relaxing and thinking. So then the question is, okay, so now are you getting the right information when you're asking about leisure? Because how people think about leisure and what they're doing during leisure differs. So then the question is, so what does all this mean? And I think the first thing that I take from just showing you all that data is, regardless of the data set that we look at, there are definitely differences by race, ethnicity, but the bottom line is across the board, regardless of race and ethnicity, most Americans are not obtaining enough physical activity. They're not obtaining guidelines. And so we've definitely got some work to do there, as we know. I think it's also important for us to continue to think about which domains of physical activity matter. And so you saw, as I was sharing some of those national data sets, depending on how you assess physical activity, whether or not there are disparities differs. And so if you look at leisure time physical activity, you might get one picture in terms of who's participating in more physical activity, but when you look at, say, work or active transportation, the disparities look different. I think the important thing about that, though, is when you take into account overall physical activity with accelerometers, just overall daily physical activity, you don't see the disparities that we see when we measure self-report physical activity in particular domains. And so I think it's important for us to think about that, because how people are getting their physical activity is different, and the domains they're getting it in is different. And so what we don't know, and what I think we don't have a lot of information about, is all physical activity created equal, right? So when we talk about physical activity, we say it's any bodily movement, and when we say, you know, all movement matters as long as it's at a certain domain. But what I think we don't know is, do you get the same health benefits out of doing moderate intensity, say, housework, as you do with doing, say, routine, purposeful physical activity? And I think we don't know that. AACORN, the African American Collaborative Obesity Research Network, has a paradigm that we use to really help to focus and guide our research around improving nutrition, physical activity, and weight management in African American communities. And as a part of that domain, one of the things that we really focus on is we want to get to this energy balance, but energy balance is impacted by lots of different things. So culture and psychosocial processes, history and social context, and then the physical and economic environment. And so I think it's important as we consider how and when people get physical activity, how they make the decisions to get physical activity, it's important to really try to understand from a cultural perspective and from these different domains, what's driving people's decisions around physical activity. And I just have a couple slides here to kind of reiterate that. And so there are cultural norms that make certain things are considered normative or normal in segments of the community, and other things aren't. And so being able to consider cultural norms as a thing that might drive why people engage in different types of physical activity is important. And I think along those lines, sociocultural factors. So depending on the subpopulation, there are types of activities that are enjoyable to people that are the norms that we want to think about as we talk about, you know, why people choose to engage in different types of physical activity and what might be the norm. I think it's also important to consider perceptions. And so this is a paper, it's an older paper by Collins, Ariambua, and Shariki, but it continues to resonate and continues to be true. So they did a qualitative assessment of perceptions about physical activity, exercise, and rest. And these are some of the things that came out. Daily activity is actually considered exercise. Rest is more important than or necessary than exercise. And so you might need to rest in order to actually be physically active. Those perceptions are important as you start to think about, you know, how and why people engage in physical activity. And real briefly, as I wrap up, I just wanted to share some data from one of the studies that we're doing. So we just wrapped up the ladies, it was a physical activity study that was funded by NHLBI, and it was a faith-based study, and so we randomized people into a faith-based, a non-faith-based, or a control curriculum. For the sake of time, I'm gonna skip through some of these slides, other than to say our population was about middle-aged. These were the baseline physical activity levels, so we recruited a sedentary population. This is pedometer data, accelerometer data. You could see the group was sedentary when we started. We took people through a 10-month intervention to teach them about physical activity, and we were encouraging walking and increases in physical activity. But what I think is important here, as it going back to perceptions about physical activity, when we look at data from our physical activity study, this is the faith-based group, this is the general or secular group, and this is the control group. We saw significant increases in physical activity in terms of daily walking. A curious finding when we looked at our accelerometer data, though, is we saw an increase in sedentary activity at the same time as we saw this increase in daily walking. And then, of course, self-report people obviously thought they did a lot more activity than they were doing based on the accelerometer. But this was an interesting finding here, that as people were increasing their physical activity, they were also increasing their sedentary behavior. We saw some small decreases in sedentary behavior as people, this was our 10-month to 22-month, so we did a 12-month no contact follow-up just to see if people were maintaining behavior, and we saw some differences there. And then overall, these things kind of balanced themselves out. But I think what was important about that is when we talked to some of our participants, they were increasing their purposeful physical activity, but in order to do that, they were resting more. So they were decreasing some of that daily physical activity in order to rest more, to prepare themselves for their participation in routine physical activity. So I'm just gonna kind of zoom through these last couple of slides. Again, I showed that how people are engaging in leisure time physical activity, there are higher rates of watching TV in the Black community. And you know, these are just some slides that point out some of the challenges that one might, depending on your population subgroup, that you might encounter that might drive how you choose to spend your physical activity during leisure time. And so we know that there's been a lot of attention recently as it relates to particularly African American men and interactions with police. And this is work by Rashawn Ray at the University of Maryland, Experiences Jogging While Black. There are data that show that there are links between total screen time and time spent in sedentary behaviors and discriminatory experiences. So people who perceived or had discriminatory experiences had higher rates of television viewing, so as a coping mechanism. So as I end here, I'll say, you know, we don't know if all physical activity is created equal. We do know that there is a push to engage in leisure time physical activity. We have not, though, really been able to move the needle on leisure time physical activity, despite what we've been doing in terms of promoting health. And it may be that people are getting their physical activity in other ways. And if there are some differences in the benefits of leisure time physical activity compared to other types, then we need to do a better job of pushing that type of physical activity. And so I'm gonna end there with just just a reminder again of how people are currently engaging in leisure time activity. And I believe Olivia is gonna take it over and talk about what we might do to decrease some of this and maybe move it towards some of these types of leisure time activities. So thanks.
Thank you very much for sharing your insights on this topic, Dr. Glover. I additionally was interested in the comments that you made on the importance of the socio-cultural context and its potential for impact on behavior. So really appreciated your insight. Please remember to post your questions using the Q&A feature in Zoom at the conclusion of Dr. Affuso's discussion. We will allow a little time for both panelists to comment on any of your questions. So Dr. Affuso will continue this discussion by addressing some of the benefits of leisure time physical activity and community-based efforts targeting African Americans.
Okay. So basically my talking points are going to cover some of the specific benefits of leisure time physical activity, and I'm going to talk a little bit about why we might consider more outdoor activities, and also some examples of some grassroots efforts primarily targeting the Black community. So first we'll begin with why, and I think this dubs well with what Melicia has talked about so far in terms of looking at why African American populations might consider leisure time physical activity in addition to the current work-related physical activity that there appears to be some evidence that maybe African Americans are not suffering from a disparity in overall activity compared to other racial minority groups. And so based on some of the work of Michelle Seeger and others who are looking at the self-determination theory and examining how different approaches to motivation affect long-term physical activity behaviors and adoption, we might want to think about some other ways to approach physical activity, leisure time physical activity in African American population. So there are some amazing programs. For example, the American College of Sports Medicine's Exercise is Medicine program that focuses on providing physical activity prescriptions through primary care providers. And one of the things that we've seen so far is a lack of uptake of these materials and also changes in leisure time physical activity amongst minority population using that kind of methodology. We've also seen that within the literature, there are numerous physical activity interventions that target African Americans that show some short-term benefits, but there are issues with long-term sustainability of those efforts. And part of the issue in terms of looking at the evidence suggests that we may need to take a different approach when focusing on the promotion of leisure time physical activity. Instead of having a health focus, shifting the focus to some of the more immediate benefits that participants may receive from participating in physical activity. So the idea of also considering outdoor physical activity is based on some previous research that reports that time spent outside is associated with increased leisure time physical activity. And more recently, there's been an increased interest in the benefits of nature on health outcomes as well as physical activity behaviors. However, there is a lack of knowledge in terms of how exactly does nature impact health and impact physical activity behaviors. There's some evidence to suggest that participating in physical activity in outside environments works through reducing stress by reducing mental fatigue and also improving cognitive function. But this is very much a budding area of research. And this does not just take into consideration the availability of green space. The question is, what is it about the green space that impacts stress reduction and mental health benefits, as well as social engagement and more physical activity behaviors? So there's been very few randomized controlled trials to try to tease out the effects of nature on physical activity behaviors and other health benefits. But there was one recent, very interesting study that examined the effects of viewing pictures of urban green environments, rural green environments, urban less appealing environments, and rural distressed environments. And what they found was that having individuals exercise on a treadmill for 20 minutes while they viewed these different photographs resulted in decreases in blood pressure, particularly among those who viewed pleasant rural scenery. There were also improvements in mood as well as self-esteem for those who experienced the photographs that were of beautiful rural environments. They found negative association between those who viewed the most distressing rural environments and blood pressure. So the idea is to shift the focus away from health outcomes of the should participate in physical activity to thinking more about valuing the benefits of engaging in physical activity such that there's an increase in a sensation of pleasure, enjoyment, and satisfaction. And this may be a great opportunity for ways to approach African American populations, particularly as we deal with stress in our daily lives. So when we look at some of the benefits of leisure time physical activity, we find that it's been well established in the literature that moderate leisure time physical activity is associated with less perceived stress. We also have evidence that participation in regular physical activity is associated with better mood. These findings have been confirmed in both cross-sectional and prospective studies. There's also been data from NHANES that show that individuals who participate in regular physical activity have significantly less issues with sleep. So they tend to fall asleep faster, report less sleep disturbances, also report report less daytime sleepiness compared to those who participate in less physical activity. There's also been some prospective studies looking particularly at individuals who suffer from sleep disturbances or insomnia, and those studies have found improvements in sleep quality due to physical activity. This is a picture of Ernestine Shepard. She is the world's oldest bodybuilder at 80 years old. And I featured her because I wanted you to think about how physical activity can affect cognitive impairment. And so there's some information, definitely prospective information from the REGARD study that showed that physical activity is inversely associated with cognitive impairment in older adults, and also that higher levels of physical activity have been associated with lower risk of memory loss and also incident cognitive impairment. So now I'm going to shift gears to really talk about some of the efforts that are taking place in the African American community. And I want you to think about this quote as we go forward. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that has. However, we need to find the data. So the first group I wanted to discuss was Black Girls Run. It was started in 2009 by Tony Carey and Ashley Hicks Roca. And they started basically with a blog. These two were college roommates, very interested in thinking about the obesity epidemic within the Black community. Neither of them are researchers. Neither of them have a background in health, but they had a strong interest in the health of the Black community. And so as Tony started running, she was told by her mother that running was a white sport and that Black people don't run. And she continued to run anyway. And she and Ashley wrote about this on a blog. In 2009, they created Black Girls Run, and there are currently 75 groups across the country of Black Girls Run with over 150,000 members. One example of how powerful this group has been is that in their Atlanta Facebook group, they have over 20,000 members. This is amazing. However, what we don't have is data looking specifically at this group to see who the people who are participating. Are there people who are already physically active? How many people have gone from being sedentary to physically active? And also, we don't have information on how long people stay in the group and actually what is their length of physical activity. So there's lots of opportunity for research to look at the impact of an organization like Black Girls Run. Similarly, another group was started called Black Men Run. It was also started by an individual in Atlanta, Jason Russell. It all started in August of 2012, where he posted a Facebook notice asking if men were interested in coming to run with him. Fast forward, according to their website, they have over 56 groups around the country with over 6,000 members. And so their focus was to encourage health and wellness among African American men by promoting a culture of running and jogging to stay fit, resulting in a healthy brotherhood. In addition, there is Girl Trek, which was started in 2010. And it was started by Morgan Dixon and Vanessa Garrison, who were college roommates. They challenged their friends and family to participate in walking, specifically looking at ways to heal their bodies, inspire their daughters, and also to reclaim their neighborhoods. So their mission is to pioneer a health movement for African American women and girls grounded in civil rights history and principles through walking campaigns, community leadership, and health advocacy. They currently have over 105,000 members participating in their walking groups around the country with the goal of reaching 1 million by 2018. In addition, there is the Outdoor Afro organization, and their focus is on connecting African Americans to nature. They currently have over 60 team leaders in 28 states with a reach of more than 20,000 people per year through meetup events around the country. And it was all based on a blog that was launched in 2009 by Rue Mapp, who wrote about her love of nature and experiences of being the only Black person participating in hiking and camping events. There's also the African American Park Experience, which was founded by Teresa Baker in 2013. And her focus is on engaging communities across the country in natural spaces through exploration and education. And this organization puts on not only a large annual event, and this year's event was the Women's Outdoor Summit for Empowerment. And their focus is on planned events with cultural relevance to encourage park stewardship. Next, we have Nature PHL, which stands for Nature Philly. And the focus of this group is to connect families with healthy outdoor play in their neighborhoods through education about health benefits, incentives, and resources. This particular program was thought of by a medical resident at the Children's Hospital of Philadelphia. And through a partnership with the Parks and Recreation, the hospital, and the CDC, and other community organizations, they are now piloting a prescription writing program where physicians, pediatricians will write prescriptions for their patients to engage in outdoor physical activity. And it's not really clear what all of their outcomes are, but according to their website, they are conducting pilot studies at 2 predominantly African American clinics in the Philadelphia area, and with the intention of reaching 21,000 children in the 3-year pilot program. Next, we have the Park RX program, which is a national initiative about connecting healthcare practitioners to also write prescriptions for outdoor exercise. And one of the case studies, Birmingham is actually a site for the Park RX initiative. And with more than 100 parks just in Birmingham, a healthy space for outdoor exercise is within reach almost any place in Jefferson County. So this initiative in the Birmingham area is being funded by the CDC and targeting healthcare providers in the local Birmingham area. And this effort is being spearheaded by Mona Fuad, who is also the director of the Minority Health and Research Center here at UAB. So these are just some examples of community-based efforts that are taking place to increase leisure time physical activity amongst African Americans. And there's still lots of research that needs to be conducted, specifically looking at how these social organizations improve physical activity. So there have been few studies that have examined the association between these social network memberships and physical activity, both in the short run and in the long run. However, it's hypothesized that there's something about the social support or the modeling of healthy behaviors that help to influence physical activity participation, but those things need to be tested. So there are quite a few opportunities to look at leisure time physical activity research. And I think we need to take into consideration a lot of the psychosocial factors and shift the focus away from the health, because we've shown that that does not sustain activity long term. Also, we need to have a better understanding of exactly how these social networks work and how we might be able to use them from a research perspective to create more and sustainable programs for African American populations. With that, I will stop there. So in summary, there are disparities in leisure time physical activity in African American populations that need to be further investigated. And we also need to think about some new approaches to looking at adoption and maintenance of activity that focus on some of the proximal benefits and also the importance of green space. And there's some evidence that the social networks promoting leisure time physical activity can be developed and sustained, but we need the evidence to better understand the mechanisms and the efficacy of those efforts. Thank you.
Thank you very much for sharing your insights as well, Dr. Affuso. I really appreciated the examples that you presented here. And obviously, what came out to me as a theme was this idea of social support, and obviously the importance for social support in terms of engaging and helping to maintain people who have decided to become much more physically active during their leisure time. I'm really surprised to hear about the numbers of people who are involved with those programs, such as Black Girls Run and Girl Trek. I do know them to be very popular in a number of communities that I've interacted with around the United States. So I'd like to open the floor now for questions and answers. And I actually have one question thus far from one of the attendees. And this individual was interested in the IPAC, the International Physical Activity Questionnaire, specifically on the short form. How do you use this tool to measure subjectively the amount of physical activity engaged in by those individuals outside the age range of 15 to 69 years old?
So this is Melicia, and I can provide an answer. And I guess the short answer would be, if the survey is not currently validated in that population, then you probably don't want to use it for that purpose, because there's not any guarantee that that survey will be accurate. However, there are, unless there's some specific reason why you would want to use the IPAC short form, there are other surveys that would be relevant for populations younger than 15 and older than 69. And a place where you could start to identify those might be the University of Pittsburgh's Physical Activity Resource Center. If you use that website, you are able to actually put in information about the population, your population of interest, and it will help pull up for you validated tools relevant for that population. And the website for that is www.parcph.org, and that's PARCPH for Physical Activity Resource Center for Public Health. But I would say, you know, in general, if a survey is not validated for our population, you don't want to use it for that without doing that testing yourself. But there are many, many, many physical activity surveys, so I'm sure there would be one for your specific population.
So right now, we don't have any additional questions that have been asked. But I was wondering, considering this concept that we had discussed before of social support, maybe you can spend a little bit of time commenting on how we might go about encouraging, incorporating social support into physical activity interventions, or interventions that include a physical activity component.
So this is Olivia. There have been numerous studies that have measured whether or not a person experiences social support. However, there is less information on how social support is experienced within some of these community-based efforts. There is at least one study that I came across that's using a prescription method for trying to increase physical activity within a medical population. And what they are doing is linking community physical activity advisors to individuals who are receiving the prescriptions but have some issues with being able to overcome barriers to actually participate in leisure time physical activity. So I think that's a new component.
What in terms of social support, I think another thing that might be important to consider as you're talking about promoting physical activity is the type of support that people need. One of the sessions that we incorporated into our physical activity study was getting people to understand what kind of support they need. And so is that support that you need someone to exercise with you, or is that support that you need someone to take over some of your child care duties or household duties, for example, to allow you space to have leisure time to engage in physical activity? So I think, you know, that's also important is for people to really understand what support they need, because everybody might not want a person with them, but they might need support in other ways, or they might need encouragement, but not necessarily a partner, or they might need a group to be accountable to. So.
And we have another question here from one of the attendees, and this is for Dr. Whitt-Glover. So regarding the information you provided about the discrepancies in the prevalence of physical activity based on the source it comes from, and also the fact that we don't have a good national physical activity database, what do you see as the next logical step to establishing a physical activity database, particularly one that allows us to collect objective data in the
Oh, that's a really good question. And I think, you know, in Haynes, from my understanding, the reason that they did not necessarily continue to collect accelerometer data is it's a costly and time-consuming process. And so, you know, I think it's always going to be difficult to try to get that at the national level, but the more we can get people who are collecting data from local sources and smaller studies that might be representative at least of their community, the more we can get those folks to collect that objective data, look at nuances within groups, and then share that data out. I think that's probably going to be the way that we can begin to build that. But I think it's also important really to try to get at what we still don't know. Even if we had a national database and we were able to show that, you know, physical activity across the board is similar, we still need some information on whether or not all types of physical activity really are beneficial for the outcomes we're trying to achieve, particularly as it relates to health. And I was talking to Olivia before this, and I was saying, for example, I might do, you know, more housework than I do you know, traditional exercise, but I don't think I get the same endorphins from cleaning my house that I get from maybe going for a walk outside. But, you know, I've got to make choices during the day. Which thing do I have to do? So I think it's important to understand, you know, are there other things that are going on with those types of physical activity that might, while you might be moving it, there might be some other things that might be negatively impacting your health.
Sure. All right, we're coming around on the hour now, and in the interest of time, I'd like to go ahead and conclude our session for today. There were a couple of other questions, follow-up questions, and please feel free to continue to post. I will be sharing the webinar via everyone who who signed up for the. I will be sharing the recording of the webinar with everyone who signed up as attendees today. But we'll also provide follow-up to the questions that we weren't able to answer during the question and answer session. So I would like to thank you all for participating in the Solutions to Diabetes in Black Americans webinar this afternoon, The Truth About Physical Activity in the Black Community. We will email a follow-up evaluation survey, and as I mentioned before, I will also share a link to the recording for those of you who may have colleagues who might be interested in the content that was discussed here today. And I will share text follow-up for the questions that we weren't able to get to during the hour block. Thank you, Drs. Whitt-Glover and Dr. Affuso, and I appreciate everyone's participation in the webinar this afternoon. Thank you.
Thanks, Sheldon.